As many of you have heard this week, Secretary of Health and Human Services Robert F. Kennedy Jr. announced he was removing all 17 city members of the CDC's Vaccine Advisory Committee and replacing them with new members. Dr. Sean O'Leary is a professor of pediatrics and infectious diseases at the University of Colorado, Denver Anschutz Medical Campus and Children's Hospital, Colorado. He's also an investigator at Adult and Child Center for Outcomes Research and Delivery Science, aka ACCORDS, and director of the Colorado Children's Outcomes Network, a pediatric practice-based research network. His research focuses on prevention of vaccine-preventable diseases through understanding clinical, attitudinal, and infrastructural barriers to vaccination and developing and testing interventions to address those barriers. Woo, Dr. O'Leary, that's a lot, but it sounds like you're just the man to talk to.
Yeah, happy to be here. Yeah, this is kind of the world I live in.
So first of all, can you tell us what this advisory committee is and what it does?
Sure. The Advisory Committee on Immunization Practices was created in 1964 in response to the invention of several new vaccines. Back then it was, polio and measles. And over the years has evolved. In the early period, the American Academy of Pediatrics mostly made the child and adolescent vaccine schedule in consultation with ACIP. In the mid 1990s, the decision was made to harmonize the two schedules. So now, although we produce our own schedule at the American Academy of Pediatrics, it's generally harmonized with the Advisory Committee on Immunization Practices. And so what that committee is a group of experts in public health, medicine. So you'll often have pediatricians on the committee, infectious disease specialists, internal medicine physicians, family physicians. Often there are nurses on the committee, public health professionals. There's always a consumer representative on the committee as well. And these are all experts in their field. It is it is sort of a career crowning achievement to get on this committee. It's highly competitive to get on it. You don't get on this committee without extensive background in vaccines. And I should mention it's volunteer. So these folks are devoting their a lot of time to this committee. And so what they do is basically deliberate on how should we best use prevention products like vaccines in this country to prevent infectious diseases. And the way they do that is through a very thorough vetting of the science. These meetings are streamed publicly. The materials are all publicly available. They're archived. If your audience wants to go see the level of detail that they review the science, it's all there right there on the ACIP website. So, and it's a very important committee in terms of how we vaccinate the US population. They are the ones who, if a new vaccine comes out, they decide how do we use it? In whom do we use it? Should we use it in the first place? The first consideration of this committee is always safety. So I've been going to these committee meetings for about a decade now, and I can tell you that every time a new vaccine is being discussed, all of the members of the committee, they hammer the pharmaceutical companies sometimes who are presenting the data from their clinical trials about the safety issues. So they're very highly focused on safety. They're very highly focused on, how much disease is this going to present? Is this a valid use of US resources in terms of the recommendations we're going to make here? So it's a really, and I should say this committee has evolved over the last several decades to be a really well-functioning group.
What was your reaction, Dr. O'Leary, when you heard the news that all 17 members were being canned?
Yeah, honestly, I was devastated. This is truly a public health crisis, and I don't use those words lightly. This was it's so. I mean, I will say there had been rumors about this, really going back even to shortly after the election that this could happen. But then with the assurances that were given to Senator Cassidy and others during the confirmation hearings that this wouldn't happen, I think a lot of us felt like maybe, okay, maybe we'll proceed with some level of normalcy. There was an April ACIP meeting. It was scheduled for February, but was delayed. And that meeting went off mostly business as usual. And so I think a lot of us in the public health community were breathing a little bit of a sigh of relief that maybe things will proceed, with relative normalcy as to how we recommend vaccines in this country. And now all of that is gone.
What is the real life impact of these firings, and what are you fearful of in terms of who will be a part of this committee now moving forward?
Yeah, I really don't know. The excuse given, well, there's a couple things here. One, the announcement that was made led with this concept that he was doing this to restore trust in vaccines, which is really a twisted irony to me, that the person who has probably done more than any other individual in the US to sow distrust in vaccines over the last 20 years is now saying he's doing this to restore trust. So, that's number one. Number two, the excuse that was given was to get rid of financial conflicts of interest among the committee members, which is also just frankly false. Those committee members are screened extensively for conflicts of interest. If there's even a perceived conflict, they have to recuse themselves from any vote related to that potential conflict. And that actually happens quite rarely. I can also say that a number of the members who were dismissed have never had any financial conflicts of interest. So to me, that was just an excuse. So I fear that it's going to be filled with individuals who are not supportive of vaccination based on the secretary's history.
What is the natural extension of that compilation of people if, in fact, they don't believe in vaccines or vaccine skeptics? What impact will that have overall on public health?
Sure. I mean, here's an analogy for you. Imagine if you took all the air traffic controllers in the US and you replaced them not with people who really didn't have any experience in air traffic control. Not only that, but they don't even really believe in flying. I mean, that's what we're talking about here. And I hate to use the kind of sound hyperbolic in terms of how severe the consequences of this can be, but we are talking about human lives here. Because as we see vaccination coverage go down, we see outbreaks happen and we see diseases come back that many of us have never even seen before. And I've never seen some of the diseases for which we vaccinate because we eliminated them in the US many, many years ago, before I trained. And so that's what we're talking about here, is children suffering and dying.
What about those who argue, Dr. O'Leary, that some of these vaccines, rightly or wrongly, the argument goes, that they need more investigation, more study, more attention to some of the unintended consequences that happen with any vaccine? Let's be honest, right? It does happen at times, even if the numbers are small. What would you say to people who are worried or believe that these things need more investigation?
Sure. That's a common refrain among anti-vaccine individuals, that we need to study it more. The fact is that we have an extensive vaccine safety surveillance system here in the US. There are many other great surveillance systems around the world that are constantly examining the safety of vaccines in real time. And it's sort of this concept that you can't prove a negative, right? You can't really, you can always ask for more. Well, if you can say that it doesn't happen 1 in a million times, but you can't say it happens 1 in 10 million times, then it might happen, right? So it's this, that they can just keep saying we need more studies, we need more studies. Now, I'm not going to say I wouldn't like more funding for vaccine safety science. I think we could always get better funding for that type of work. But the fact is, there is a very robust system that are examining exactly those questions as we speak.
They also have been studied extensively already and rigorously and tested and analyzed and monitored, et cetera. Can you talk about the system that is already in place that would potentially convince some vaccine skeptics that they are in fact safe and really important for public health?
Sure. Yeah. So there's a general principle that vaccines are held to a much higher safety standard than other medicines that we give. So, for example, aspirin. You get a headache, you take some aspirin, you might get an upset stomach, but you'll put up with the upset stomach because you have a headache, and that's better than getting getting rid of the headache is more important to you. We will put up with certain side effects. And sometimes, for aspirin as an example, there are potentially fatal side effects from that medication. Vaccines are different because we're giving them to healthy people to prevent disease. They are held to this higher safety standard. And that's true both in the clinical trials before a vaccine comes to licensure and then afterwards as well. And so in the preclinical trials, you may remember the COVID vaccine trials among 30,000 to 45,000 individuals for the two vaccines that eventually got licensed and most used in the US, very large clinical trials. And you can detect in those types of trials things that happen on the order of, 1 in 1,000, individuals, maybe a little bit less than that. Things like a sore arm, headache, those types of things. But it's just not feasible to do a clinical trial large enough to detect these rarer potential adverse events. And so we have these extensive safety surveillance systems in place to do just that. And I would say that through the COVID pandemic was a good example of that system working as it should, right? So we had within a matter of days of the vaccines being rolled out, we were able to tell that there was a very rare risk of anaphylaxis, so a severe allergic reaction, roughly 2 to 5 per million individuals. We were able to identify that within a matter of days. Some of these other quite rare side effects were able to be identified within a matter of days to weeks as well. And then the ACIP, among others, weighed the risks and benefits, looked at, okay, we know this remote risk exists. Should we continue to recommend the vaccine or should we not? And in most of the cases with these very rare remote risks, it was clear that COVID was much more severe than these remote risks. And so the decision was made, in some cases, to continue vaccinating that population. In other cases, the concern over safety was high enough that we said, no, we're no longer going to use that vaccine. And that was true of, for example, the Johnson & Johnson vaccine, which was removed from the market because of a safety concern on the order of 1 in tens of thousands of individuals. So I would say that's an example of the monitoring that's going on and the decisions that are being made and why they're being made.
I know that there has, as you mentioned, already a decline in routine childhood vaccinations. I have to think that a move like this will only sow more distrust in vaccines just simply by this, this effort to fire these people and replace them with new ones. How fearful are you that this will cause an even more precipitous decline in compliance rates?
Yeah, I'm very concerned about that for sure. I think I can't see how this maneuver is going to increase trust in the process. I will say the vast majority of parents vaccinate their kids on the routinely recommended schedule, and I think many parents will continue to do that. The problem is that when we see even small dips in vaccination coverage, that's where we see these diseases come back. And we're already seeing that, for example, with measles. We had greater than 95% coverage, up-to-date coverage for children in school going into the pandemic in 2019, 2020. That has dipped a couple of percentage points at this point. And you see what's happening with measles right now. We've got the largest outbreak. We're probably going to surpass 2019, and this will put us into the largest outbreak since the early 90s in terms of the number of measles cases. We've already seen 3 deaths from measles. We hadn't seen a single death in a decade, and we hadn't seen a death in a child in 20 years. And we've already seen that this season. So further erosion in MMR coverage, measles coverage, and then other vaccines can only mean that we're going to see more and more of this over the coming months and years, unfortunately.
because you won't reach herd immunity, right? Where
Correct. Yeah, I tend to use the term community protection or community immunity, but yeah, because we try to maintain a level within the community that prevents outbreaks from spreading. So the vaccines protect both the individual, but they also protect those around them as well.
I know that it's been proven multiple times, and the person who got attention for saying there was a correlation between vaccines and autism was disproven. He's still out there, though. He is still, Andrew Wakefield, I believe is his name, still spewing his anti science rhetoric. It seems to me that a lot of parents who have children with autism, Dr. O'Leary, don't understand or have no answers in terms of what caused their child's autism. Some people say it's being monitored and reported on, and there's a greater awareness. But I still think there are people who feel that they just don't understand. Do you think more research in autism, not necessarily by Robert F. Kennedy Jr., but a more concerted effort to uncover what actually causes autism or children to be on the spectrum would then take some of the focus off these vaccines? And is that a possibility?
Sure. Yeah, good question. I mean, that myth has really persisted. And there's the old saying, a lie gets around the world before the truth gets its pants on, and that's really what's happened here. This was a fraudulent study from the late 1990s that has been summarily disproven. There were egregious conflicts of interest in terms of Andrew Wakefield himself making money, making these false claims. So really horrible, horrible stuff. Yet that myth still persists.
Well, he still is peddling it
Oh,
too.
I know, I know. But the truth is that there is a lot of research on autism and its causes, and we learn more and more all the time. Unfortunately, a lot of the cuts that we've seen at NIH are not going to help with that. And the one thing that we know based on many, many studies that doesn't cause autism is vaccines. That's been proven beyond any kind of a scientific reasonable doubt. And yet here we are, right? So yes, more research uncovering causes, et cetera. A lot of what's been discovered in the work that's been done is that there are often underlying genetic predispositions to autism. And
There's not one answer necessarily.
but not one single answer, correct. And we know certainly that it is not vaccines.
If you had an opportunity to be speaking with RFK Jr. instead of me, what would you say to him today?
I would ask him to reconsider this decision. I think this is a terrible decision. I think it's only going to sow further distrust in vaccines, in the federal government's recommendations of vaccines. So that would be the first thing I would ask of him, is to strongly reconsider this misguided decision.
Dr. Sean O'Leary, Dr. O'Leary, thanks so much for your time.
Thank you. Thank you. I really appreciate it.